welcome back to Teach It Tuesday. Hope you all had a wonderful week and a wonderful weekend. Today I'm going to discuss end feel. What is end feel and why do we need to know what the end feel is like? So the end feel is a type of sensation of feeling which the examiner experiences when the joint is at the end of its available passive range of motion. So the end feel is something that we feel when we are examining passive range of motion at the joint. The end of each motion is limited from further movement by particular anatomical structures usually. The type of structure that limits a joint has a characteristic end feel, which may be detected by the therapist performing the passive range of motion. This feeling, which is experienced by therapists as resistance or a barrier to further motion, is called end feel. So why do we assess and need to feel for end feel? So end feel can support our passive range of motion assessment to assess for any type of pathology present, to identify limiting structures and choose a focused and effective treatment method, to determine a prognosis for the condition and learn the severity or the stage of the problem within the joint. By determining whether there is pain or restriction as the main problem to the end feel of the joint, the examiner can determine if a more gentle treatment should be given, or a more vigorous treatment can be given to improve the joint range of motion. So there are some widely recognised classifications of end feel. So I'm going to demonstrate passive range of motion on bear. And as I am doing these joint range of motions, I will discuss the feeling and end feel. So if we take the stifle, so the stifle range of motion is predominantly flexion, extension. Okay, so keep it nice and simple and we'll just be testing flexion and extension of the stifle. So in flexion, the end feel is quite soft and spongy. This is because we've got the gastrocnemius and the hamstrings almost butting up together, and that's what we can feel as we're taking the stifle into full flexion, almost like a stretchy, spongy end feel. So that's normal for the stifle flexion. The stifle extension almost got a hard, slightly elastic end feel. Okay, so this is because we've almost got the two bones, the femur and the tibia, butting up against each other, causing that hard end feel. And the tiny bit of springy feeling that we can feel is just those ligaments giving it a bit of laxity into that extension there, which is normal. Okay, so we've got a spongy end feel where we've got two soft tissues or muscles butting up against each other, and then we've got a hard end feel and a tiny bit of give at the end of that extension. So let's have a little look at the hock or the tarsus. So again, in flexion, we have got a spongy end feel where we've got the soft tissues just coming into contact with each other, and in extension again we've got a harder end feel, but we've got a tiny little bit of laxity there where the ligaments are just giving that last bit of extension into the tarsus. The other things that we need to be looking for within our joint passive range of motion are obviously pain. muscle spasm. So is it pain that's limiting our full range of motion? Is it muscle spasm or joint tightness that is limiting our range of motion? Or if we have an increase in the range of motion, so if we knew that there was a tiny bit of give in that tarsus there into extension, but we came to assess the tarsus extension and we had a lot more give and a really big springy give in that extension, then we might be considering that there's dysfunction within the ligaments that are stabilising the tarsus there. Okay, hope you enjoyed this Teach It Tuesday, and I hope that explains what end feel is.